Thank y'all all for being here today. My name is Emma Marengo, and I'm honored to be able to introduce to y'all Michele "Kid" Sutton. She is the current chairperson of the board of the American College of Healthcare Executives and chair-elect of the Louisiana Hospital Association. Ms. Sutton has spent 37 years enhancing healthcare access in Louisiana. She became president and CEO of North Oaks Health System in 2016, and under her leadership, North Oaks has earned recognition as the top 10 best performing health systems by Modern Healthcare. They have also improved their bond rating, became one of 11 trauma centers in the state, achieved multi-million dollars in expansion projects, and just launched a graduate medical education program. Ms. Sutton is the perfect person to update us on the state of the health of our population in Louisiana. Please give a warm welcome to Ms. Michele Sutton.
Good morning, everyone. Before I get started, it's my honor to recognize a few elected officials who are here with us, and I'd ask that you hold your applause until I introduce them all. St. Tammany Parish President Mike Cooper, State Representatives John Weibel, Kim Carter, Peter Egan, and representing Senator Patrick McMath, Noble Bates Young, and from U.S. Senator Bill Cassidy's office, Kathy Stewart. So it's not going to be a surprise when I say healthcare is big business, and it affects everyone in this room. And to illustrate my point, I'm going to ask you a question, and if you agree with the answer, raise your hand and keep your hand up. How many of you have ever gone to a doctor? A hospital? You have a loved one who has a chronic condition. So if you look around, every hand has been up in this room because healthcare affects everyone. So why should we care? A healthy workforce should be more important to employers now more than ever. Why? Because last year at this forum, we heard from William Sims. There simply are not enough workers for the number of jobs that are available. By 2030, there will be more people over the age of 60 than under the age of 18. We need our aging workforce to lead healthy, productive lives for a robust economy. It is for this reason that I'm here discussing these thoughts with you as part of the SLU Economic Business Forum. The business community can and must play a great role and be a part of the ongoing collaboration to develop and align strategies to improve health, not only in the workplace, but also in our communities. I will share a few reasons why it's important for employers to concern themselves with the business of healthcare, and more specifically, the health of their employees and their use of the healthcare system. Once we see the rationale for the employer investment in the health of its workforce and the population from which it derives its workforce, we will briefly review some of the sobering facts about the state of health in Louisiana and on the North Shore, and consider the challenges we all face in advancing equitable health for all. I've prepared this presentation in 3 parts to provide the foundation and background for our subsequent expert panel discussion on strategy for a healthier North Shore. By 1, the business of healthcare, 2, health outcomes of our community, and 3, the health of our community. It is no surprise that healthcare plays a critical role in fostering a vibrant economy. As we look at the economic impact Healthcare represents 17% of Louisiana's GDP. 17%. If you look at the number of jobs, healthcare accounts for more than 16.8% of all state employment. Almost 320,000 jobs in Louisiana are attributed to healthcare. $18.4 billion in annual payroll, which is more than 16% of Louisiana's annual payroll. And it generates $2 billion in state and local taxes. So let me ask you, what do you think are the top 3 industries in Louisiana by the numbers? Coming in third is the hospitality industry with 194,000 workers. The next industry is retail with over 219,000. And then you just heard me say the number 1 is healthcare with almost 320,000. Then, if you look at the payroll, one of the things I like to point out is not only do we have the most jobs, but we have the highest payroll because of the expense of those workers. At $18.4 billion is the payroll for healthcare in the state of Louisiana. When you bring it back here to the North Shore, and for purposes of today, we're going to define the North Shore, those parishes within the North Shore Health Collaborative that Dr. Wainwright spoke of, and those parishes are St. Tammany, Washington, and Tangipahoa. 10% of the state's healthcare employment is in those 3 parishes. 10%. When you look at it by the 3 parishes, Tangipahoa has 22% of the jobs in the parish are in healthcare. Washington, 21% of their jobs are in healthcare. In St. Tammany, 20% of their jobs are in the healthcare sector. Then, when you look at the economic impact, it goes beyond healthcare because for every healthcare job, there is a multiplier of 0.63. So for every job in healthcare, an additional 0.63 jobs are created in the economy. The healthcare industry multiplier can be used to determine the number of jobs in the economy that are supported by the sector. On the North Shore, the 26,152 jobs in the healthcare arena create or support another 16,555 jobs in the region. This results in the total of 42,707 jobs supported by the industry, representing about 26% of the region's overall employment. 1 in 4 North Shore jobs can be attributed to the healthcare industry. This same calculation can be applied to earnings and sales. The healthcare industry supports 22% of the region's earnings and 16% of its sales when the multiplier effect is considered. So let's look at the economic contributions. We're the leading contributor to the region's GDP. In 2023, the healthcare industry added $2.4 billion in value to Louisiana's economy, which is $637 million more than the next highest producing in the region. The economic health of the North Shore in Louisiana is heavily dependent upon how well the healthcare industry does. So now, part 2, let's look at health outcomes. Unfortunately, these are some sobering facts that the state is working on with us. Out of all 50 states, Louisiana ranks 50th. Social and economic factors, 50th. Physical environment, 47th. Clinical care, 38th. Behaviors, 49th. Health outcomes, 48. Then, if you look at what are our major diseases and where do we rank? Cardiovascular disease, 42nd. Obesity, 47th. Adults with diabetes, 46th. Low birth weight babies, 49th. Sexually transmitted diseases, 48. When you think about that and then take it to the North Shore, what does it look like here? I would suggest to you that there are many factors that will affect the health and outcomes of individuals, and I'm going to show you why in just a second. So first, if we look at the median household income, if you look at the 5 Florida parishes, Louisiana's average household income is $60,000. St. Tammany is number 1 on the North Shore. Average household income, $79,277. Keep that in mind as you look at Washington Parish is below Louisiana's average at $42,000, as is Tangipahoa at $57,000, because I'm going to show you the correlation in just a second. Also, when you look at the poverty level, Louisiana's poverty level is at 19%. The national poverty level is at 11.1. So there's a reason why we're the 50th. Then if you look at the poverty level in Washington Parish, it's at 23%. Tangipahoa's at 19%, but St. Tammany is blessed at 12%. Then education plays a part in healthcare. High school graduation rates, state average is 87. St. Tammany's the only North Shore hospital that is excelling at 91%. Tangipahoa and Washington are both at 84%. Then when you look at the education levels of people who have a bachelor's degree or higher, Louisiana is at 27%, St. Tammany is at 37%, Tangipahoa is at 22%, and Washington at 13%. And then when you look at the unemployment, currently the national average of unemployment rate is at 4.1%, so we're all pretty much right in with the national. But then when you look at Medicaid percentages, the state, 35% of our citizens are on Medicaid, but there's a lot of disparity on the North Shore. And why is that important? A lot of providers do not accept Medicaid. It's hard for them to get access to health care. And that's going to show in just a second in outcomes. Then when you look at obesity, 40% of our state is obese. 40%. The national average, however, is 42%. But again, St. Tammany is 30%, Tangipahoa 35%, and Washington 37%. So let's take it all together in a snapshot and look at the North Shore and the Florida parishes. Out of 64 parishes, St. Tammany ranks number 1 in outcomes. And why? Think about it. They had the highest income, the lowest poverty, the best education. They're doing right things in St. Tammany. Livingston is 10%. Tangipahoa is in the middle at 39th out of the 64 parishes. Washington is 53rd, and St. Helena 61st. So we came together to do North Shore Healthscape Collaborative. As I mentioned, it's Tangipahoa, St. Tammany, and Washington parishes. We wanted to be a healthcare destination, be a healthcare economic development hub, and focus on workforce development, because we know healthcare is more than just a service industry. It's one of the largest economic drivers of a local economy. Economic development may start with an adequate healthcare system, but it will not continue to flourish unless an acceptable healthcare system exists. Employment in hospitals are more substantial due to the demand of highly skilled personnel needed to deliver medical services. And economic development may start without an adequate healthcare system, but it will not continue to flourish unless an acceptable healthcare system exists. Employment in hospitals are more substantial because of the skilled workers that we need. Along with providing vital, life-saving medical services to their communities, Louisiana hospitals are significant economic drivers statewide. We have an impact on employment and wages, economic contributions, tax revenue. Healthcare's impact is not only one of economics, but one of health and safety. We're there when Mother Nature throws her challenges at us with floods, hurricanes, pandemics. We're an industry resource to you in times of crisis, and we're leaders in our community. We are truly blessed on the North Shore to be rich with resources. We have two great universities and colleges, one with Southeastern Louisiana University and then with North Shore Technical Community College. But then the natural resources that make us perfect with the interstates, the airport, the port, the rail, and vibrant health systems, all working together to improve. But like many of you, healthcare does have an uphill battle. We have many challenges. We have workforce shortages. We have reimbursement issues. We're worried about the tariffs, inflation cost, ethical use of AI, health equity, baby boomers. According to the US Census Bureau, by 2030, 1 in 5 will be retirement age 65, outnumbering people under the age 18. Just think about that. That's only 5 years away. 1 in 5 people will be retirement age. By 2034, there will be 77 million people 65 and over, compared to 76.5 under the age of 18. In 2020, there were 3.5 working adults for each retirement age person. By 2060, there will only be 2.5 working adults for each retirement age person. I can share that the business of healthcare, the delivery, the workforce shortages, they're real. They impact patients, they impact your employees. But in order for all of us to be successful, for our success to be real, we have to work harder and harder to meet the demands placed on us and to try to keep people healthy and out of our hospitals. Because when people come into the hospital, it's expensive. It drives up your healthcare cost, which you feel as you're trying to provide benefits to your employees. To give you an illustration, at North Oaks alone, We currently have 163 employees out on leave. That's a cost of almost $2 million, but that also limits the amount of patients we can see when they're out as well. So the last part I want to talk about, part 3, is the health. Healthcare delivery business, workforce shortages are real and are already impacting patients, your employees, in the form of access, long wait times for appointments and procedures, and it's getting harder and harder to meet the demands placed on an operational and financially stressed healthcare system. This drives up healthcare costs, which you feel in your businesses as you provide benefits to your employees. So we can look at it in one of two ways, either through care or through prevention. The topic of preventable health conditions versus treatable conditions is relevant in any assessment of how a home, workplace, community, state, nation, or world spends its healthcare dollars. According to the World Health Organization's Commission on Social Determinants of Health, dating back just over 10 years, 50% of what makes an individual ill or well is determined by health behaviors, which supports research findings that most chronic illnesses are preventable, yet 80% of the $2.6 trillion spent annually in the US on healthcare costs went to care conditions related to lifestyle choices and environmental factors, with less than 4% going to improving health behaviors and to preventative medicine. Behavioral and lifestyle choices not only impact whether and how often an employee will use the healthcare delivery system, they drive how long an individual, once in the system, will remain in it, and the degree of available improvement. And this can be tied to two key patient-dependent factors. One, do they have what we call comorbidity issues? Do they have a secondary illness that's complicating their recovery? Or two, do they have the means to be physically compliant? Do they have the money? Do they have the resources? Do they have, you will hear, food? Do they have housing? Do they have electricity? Because in some of our communities, not everybody has equal access. So the vision for us is that right now it may look bleak, but I'm an optimist because I know the panel that's coming up next, the caliber of these individuals, the work that they're doing, I believe that our vision is bright. Because when I look in the mirror and I look at my colleagues, I know what they're doing. They're developing strategies for a healthier North Shore so that we can all smile. And I believe we have long played a role in supporting the health of our residents. It was within the four walls of a hospital. Now healthcare must step outside of the four walls and really focus on preventable health and working with our communities in order for us to have a healthy and vital community that we live in. Thank you.